So, is everybody familiar with Teams and comfortable with? Can the people who have got their videos off, could you give me a thumbs up if, or put a comment in the chat if anybody? Hi, Priya, how are you doing? Yeah. So, if great, thanks, Louisa. I think you probably are all familiar. So you know you can use the emoticons if you, as we're a small group today. I had planned to use breakout rooms a bit later, but I think we're a small group, so we can just have a conversation between ourselves. So welcome to the quarterly Health Champions and Stakeholders Network meeting. I was just explaining to Kilner that the Health Champions programme is all about providing persons within the voluntary sector and some statutory organisations where those people are public facing, so libraries, schools, other parts of the system. Yeah, maybe some health and social care roles, maybe maybe some of the social prescribers have also who work in primary care networks have also been part of the Health Champions training. So the point of the Health Champions training, I might as well bring the visual up actually. Sorry, not the health yet. Let me go into the chat and bring up the open that document if I can. Morning, Andrea.
Morning.
Right. I think I'm going to share the document. Just a second. Can everybody morning, Andrea. We've got the agenda, Andrea, and the Health Champions project visual in the chat. I don't know whether you can see those. Yeah. Okay. So the project visual. Let me just pull it up because as we're a small group, we might as well have a quick overview of it. Just bear with me a minute. Morning, Tony. Right. I'll just share my screen. So can you all see what I'm sharing there? A visual with some sort of red circles in the middle.
Yes.
Yeah, good. Okay. So the Health Champions programme, and we've got a few health champions on the call, so they'll be able to talk about their own experience in a minute. The Health Champions programme was set up so that people within voluntary sector organisations, so that's the areas in the red discs, would be trained, which is up here in the second box at the top from the left, to be in Royal Society for Public Health, influencing health behaviours, understanding physical activity, the impact of physical activity, making every contact count, mental health first aid, community participatory research, and other things. And the objective was that they would become trusted partners within the voluntary sector for our statutory services colleagues. And the point being that voluntary sector organisations are the specialists in whatever area of work they're involved with. So there might be a tiny niche organisation, but they intimately know their service users and their service users' needs. Or they might be a larger organisation which is dealing with a more specific project like say homelessness or the travelling community or immunisations amongst the Black and Afro-Caribbean community or whatever. It doesn't matter what it is, but the point is every voluntary sector organisation is a specialist organisation in one way or another, and they also have a trusted audience. They have an audience, a network, a service user cohort that trusts them. And we know that health behaviours are, I mean, the system calls it lifestyle choices. We know, for instance, that 50%, or public health tell us that 50% of all preventable deaths are as a result of 4 health conditions, which are as a result of 3 choices we make on a daily basis. And they are smoking and other substances, the amount of physical exercise we do, and what we eat. Now, we all know it's not that simple just to tell people that they need to eat more greens. So the people who are the most in the best position to be influencers amongst some of our most vulnerable communities are our colleagues. That's some of you on this call in the voluntary sector, because the people you work with and that you provide your existing services to trust you. And the overall aim is to transform health and well-being in Enfield and improve co-production of health and wellbeing services. And this is a statement, improving co-production of health and wellbeing services, that is parroted all over the place. But in reality, it means that the people most affected by health inequalities have a say in how health and wellbeing services are shaped, designed and delivered. So those are the ambitions, so that everybody in Enfield, every resident, has the opportunity to live a life that is classed as healthy and they enjoy well-being. And that's a grand aspiration, but it's a real one. And there are other projects going on that are also sort of linked into those agendas. It's not just the health champions. But I don't know how much. So that visual there that is up is meant to show you that some of the themes we're working on are here in the middle, but the EVA's job will be to support the health champions so that they become the voice and the experts, recognised and respected experts in Enfield across the strategic as well as the operational areas of health and care in delivery in the borough. And that is significant at this point in time because you may or may not know, to a lesser or greater degree, but the health care, NHS and statutory services have moved into, the clinical commissioning groups have been replaced by integrated care system and integrated care partnership. And that is all aimed at putting people at the centre of health and social care. So I'm just going to stop sharing that because you can all look at that in your own time. But that's the foundation for what the Health Champion programme is meant to do. Now, the Health Champions aren't paid people by the programme. They are paid in their existing. Could we add an additional? Yes, Hilner, I will look at that. I will look at that separately. Yes, that's a very good suggestion. Thank you. The health champions are in their existing role in their organisation. And today we have Andrea from Focus CIC. We have Tony Dallas from Success Club CIC. We have Kim Thompson from United We Rise. Have we got any other health champions on the call? I mean, there's about 40 active health champions in the borough, and I can provide a list of the organisations that they're in. I'm happy to share that. So these people that are on the call today, who can speak for themselves shortly, they've got a job or a role, and some health champions are actually unpaid in their organisation. They're a trustee of their organisation or a long-term volunteer, but they've got a role that they have within the delivery of that organisation's specific activities and services. But as a as a health champion, they're able to work with me and represent what they know strategically. Andrea herself sits on one of the integrated care partnership Enfield specialist committees, which is to do with children and young people. I'm not sure how that's going, Andrea. We haven't had a chat about that recently, but the thing is that this is what we're aiming to do: is create opportunities for the specialists within the voluntary sector to be the voice where decisions are taken around service design and resourcing and so on. And we all know, I'm sure you're all aware of Tuckman's model of form, storm, norm, perform. And it takes time to build successful relationships because they're dependent upon trust and shared values. So that's all part of the mix. Now, the health champions can also access funding. Some funding gets ring fenced for organisations that host a health champion. And I think each of the people on the call today have perhaps accessed some of that funding. Each of the health champions on the call, their organisations have accessed that funding. And we're in the process of sort of monitoring and evaluating how that model is going. And the point there is that health champions receive funding from funders that they wouldn't normally. Sorry, not the health champions don't receive it. It's the organisation that the health champion works for receives it. They receive funding that they perhaps wouldn't normally have access to because NHS and statutory services often have onerous commissioning processes. But through these new structures that we're creating, smaller grassroots voluntary sector organisations, the specialists, can access pots of money that can make a significant difference to either their activities or the lives of their service users, or both. Which are in the space of addressing health inequalities. And health inequalities, of course, are all linked into socio-economic factors, which this meeting isn't designed to discuss today. But if any, I mean, that information, I can share that information if anybody wants more about it. So the purpose of the network meetings is to just connect people and to hear from individuals within our systems that have got something they want to share. And in the past, the network meetings have had quite a busy agenda. They're usually from 10 till 12:30 online, and they've had a very busy agenda with lots of speakers. So the speakers might be from statutory organisations talking about a health factor that's currently really important, like weight management, smoking cessation, some of the things, it might be about vaccination challenges within specific parts of the community. And because it's good to remember that the programme that's funding this project, which is the NHS Transformation Fund from 2021, that was all about addressing health inequalities, that specifically around childhood obesity, but it was to do with the issues that people in the east, mainly in the east of our borough, within certain demographics face. And so many of the health champions represent or are linked into and are trusted by the communities where the health system and the statutory system is busiest, has the most concerns, and so on. So our speakers would be people who would be wanting to connect with voluntary sector specialists to get their feedback, or to be able to link in so that they can work on joint, disseminating information. Because if I don't know many of you on this call terribly well, but if you said to me, Helen, we're promoting weight management or doing more exercise, here's a leaflet, if I saw you in the street and you gave it to me, I'd say thank you very much, put it in my handbag, and maybe not look at it again. Whereas if you're a service provider and I see you on a regular basis because I go to one of your activities, a tea dance that happens in Edmonton Green, or a walking group that takes place in the local park, and you say to me, although if I'm on a walking group, I'm already doing some exercise. But if you said to me, we want to, what do you think? We want to increase what we do. We're thinking of making the walk twice a week and then having a session on the park gym at the end of the session. What do you think? I'm likely to say, go on then, or I'm not really interested. But the point is, because I know and trust you, I'm likely to say, okay, and I'll listen. And that will influence my behaviour. And if we all did that, making every contact count, then we'd have a revolution on our hands, a good revolution. So today's meeting is about what we can do, how we can use these network meetings going forward. So today's meeting is only meant to be 90 minutes, so I'm not taking up a huge amount of your time, or as much as usual. So if I can get the discussion going, what I'd like to do first of all is those people who have newly joined, in the chat, you should be able to access the agenda, and it is basically what I said in the invitation. I want to, by the end of the meeting today, I would like to have just had a general discussion about what the network meetings, what you want from them as an individual, and therefore how they should be structured going forward. And the next meeting, which is July the 20th, which I understand is not in the school holidays, but I do need, because when we set these dates, we always check school holidays. But if anybody's got any comments about the date, then please include that in the discussion. But the next event is meant to be an in-person event, because we want to have some face-to-face contact, and it's nice from time to time to actually be human beings socially together, and it will be somewhere in Edmonton. So part of our discussion will be about what the in-person event should be about. Should it be you know, more social than preachy and conferencey style, or whatever. So so as we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 of us, I think that will be better if we go into a couple, 2 or 3 breakout rooms actually. But what I'd like to do first of all, if it's okay with you, is just do a round the room introduction. So if you can say your name and the organisation you work for, and maybe what you do, because some of you are from larger statutory organisations. So if you can say your specific area of work, and I'd just like you to also say at the end of your introduction what living creature or thing you saw on the way to work, or if you're working from home, and what you've noticed this morning. So I'll start us off. So you all know me. Well, you all know me now. I'm Helen Price from Enfield Voluntary Action, and an Enfield Voluntary Action is a voluntary sector infrastructure support organisation that supports sustainability, attracts funding for voluntary sector organisations, helps to manage change, and is a strategic link with the statutory system within the borough and within the sub-region, which is called North Central London. So I this morning just noticed my cat. I've got 2 cats, and I always appreciate the fact that they are always really pleased to see me, even when I'm grumpy. So that's my bit of nature for the day. So if I can nominate someone, and then when somebody speaks, if you can nominate the next person until we've all spoken. So Tony, Dallas, I'm going to go to you if that's okay.
Yeah, good morning. Hi, Helen. Good to see you. I'm sorry that my video is not on today. I've got an eye infection and it doesn't look very nice, so I don't want to put people to that. And as is my way, somebody was supposed to be running a session for me this morning and they pulled out, so I'm kind of in between. So I am here. My name's Tony Dallas. Hi, everybody. And I am the CEO and founder of Success Club, which is a children's charity that works probably 90% of its time in Enfield, in and around Enfield. We work with children and young people and their families. We do a lot of well-being and personal development sessions. I'm a qualified mindfulness coach, and my ideology is how we can teach people to self-soothe, especially in this time of stress. We do that through the children because they're the quickest route to the families, parents and guardians. And I love the job that I do. What did I see this morning? Magpies. I say good morning to magpies. Usually people say good morning, Mr. Magpie. I like saying good morning, Mrs. Magpie. Let me see. Vidya, over to you.
Hi, good morning, everyone. I'm Vidya. I'm one of the type 2 diabetes health and wellness coaches, work for Enfield Diabetes Community Services and representing them today. So yes, my main role is to help patients with type 2 diabetes make lifestyle changes. As we're all aware, type 2 diabetes is a lifestyle disease. So really supporting them with dietary modification, helping them engage and increase physical activity to improve their blood glucose levels, as well as minimize their risk of developing further health complications. Interestingly, in the last 2 weeks, I've had a few patients who've mentioned, they would like to or quit smoking, but haven't really had the help or the support. So I was just thinking to myself, what next? But I'm glad to be here. Seems like my questions will get answered today. And then I also had a patient who sadly said that she can't afford healthy food because it's too expensive. So yes, we do have patients who are vulnerable, seeking support and unable to reach. So I'm glad that we have the health champions providing this support and being our go-to, if I should mention. So that's my role, and I'm looking forward to meeting some of the health champions in the area who we can liaise with to support our patients. I haven't stepped out because the schools have striked, so I'm working from home, and I can see a pigeon sitting in front of me for a very long time. It's been there for the last 10-15 minutes. So yeah, hey pigeon.
Sorry, mute. Can you nominate the next person to speak, please?
Sure, I've got Andrea.
Thank you.
Morning, everyone. I hope the noise is not too much. I'm actually had a late start to my day, so I'm in the gym. So I'm Andrea. I'm the founder and director of an organisation called Focus, CIC, Focus on Creating Your Ultimate Self, and it's aimed at working with young people to educate and empower them about the benefits and importance of physical and mental health. And I'm practicing what I teach as I'm in the gym now. It was born out of my own lived experience of being diagnosed with a mental health illness, and I'm a former secondary school teacher, so I'm quite used to working with young people anyway. And outside of working with Focus CIC, I'm a trauma-informed mindset coach, and many other things as well, and a hypnotherapist. And I haven't tried it with, I know that the last speaker was talking about giving up smoking, and I know hypnotherapy is used for that as well. So maybe that's something that we could possibly explore. But I think I've covered it all. If not, Helen knows quite a bit about me already, so I'm sure she could fill in the gap.
And Andrea, don't be shy. Andrea was the first.
Oh, British champion bodybuilder, yeah, and first woman to represent the UK in amateur bodybuilding, and one of the very few black women that are doing it as well. So in the UK, mostly, yeah.
So very inspirational.
Thank you, Helen. Bye, everyone.
So what about Andrea? What about your piece of nature? Something of nature this morning.
Oh yeah, so it wasn't nature, but I sent my friend a video. I normally send her videos of dogs, but this morning it was about a little tortoise. So that was that was me. So it was a tortoise, not a dog. And I'll pass it over to Kim.
Thank you.
Good morning, everybody. My name's Kim Thompson. I'm the health champion for Helen for Enfield. I'm also the founder of United We Rise UK. So we unite businesses with already established businesses. We also, sorry, one moment, I'm in a meeting. Sorry about that. Perks of working at home. Yeah, so we deal with a lot of trauma related cases, child abuse, child rape, child sex abuse. We've been working alongside a number of different organisations, and what we've actually found is creating an environment where people can just come down and meet other people, music, games, etc. We've been able to help them with other issues that are going on within their life and signpost them and spread awareness to available health resources from Enfield. So we've been asked to actually take it around to other boroughs as well. So I'm really glad about that. So everybody in this meeting, if you'd like to liaise with me so that we can, what we've found is we bring our practitioners to their venues, and it's actually helped to bring people out of their, I say out of their box, actually start speaking. We've set up support groups. As a result of being a health champion, I'm able to now, target them and signpost them to the relevant resources that we already have that's available, and that's from Enfield. So I'm really happy to be here, really happy to meet up with you guys, and looking forward to working alongside you. What animal did I see? I have robins. And they make me smile every morning. I'm going to make my coffee, and I have 2 robins that sit on the fence. It's almost as if they're saying, "Good morning, Kim. Hello, we're here." Because sometimes I see one of them on the fence and I'm like, "Where's the other one?" And the other one pops in. It's almost like they say hello and then flit off again. So it kind of brings a bit of joy to my morning. What else did I say? We're advocates of supporting young children, families. And that's really to help improve their lives and get them to become the best version of themselves. Which, if they also have a business wise that is providing well-being for the community, we're also helping them to uplift their services as well. So that's all about me. Yeah, and I'm going to now target Carmen.
Hey everyone, and thank you. First of all, just checking, is my microphone okay?
Yeah.
Okay,
Yeah,
great.
we can hear you.
Thanks. I'm Carmen. I work in the Enfield primary care team, so I work closely with the GPs. And at the moment, I'm working on digital exclusion, so working on a few projects to enable people who might not be able to access GP services, like via apps and stuff, to use them. We've set up a homeless GP service, and a few other bits like that. Just anyone who's experiencing any inequality with accessing GP services, we try and find solutions to that. So looking forward to being part of this event, and I think that's all I need to say. Oh yeah, I also have 2 cats, and they're currently asleep, and I'm just so jealous of them. Honestly, if there's a next life, I'll choose to be a cat. But for now, I'm happy in Enfield. And I think that's everything.
Thank you. And if you can
Thanks.
nominate the next
Oh
speaker.
yeah, there's Priya.
Might help if I was not muted. Good morning. First meeting in. I come in from GAM Care, which is the national charity that supports anyone impacted by gambling and related harms. My role is as engagement lead, so that's really working with other voluntary sector organisations, statutory bodies, to raise awareness around gambling and related harms. So we've done work with what we would say is where people often come to, so housing organisations, citizens advice, domestic violence. So really what I'm looking for is making connections, and also the invitation, if you have an event, a wellbeing event where you think it would be appropriate for GamCare to have a stand, we can come along. And we also offer CPD accredited training for practitioners who are supporting service users. So one of the things that we do is the CPD training course looks at what is gambling, the impacts of gambling, and supporting the gambler as well as the person who's what we would say is affected others, so family members. and that could be delivered online or in person. So that's my role. Comes to nature in the morning. So this morning, actually, when I was having my cup of tea, I saw a tomcat in the garden, which is unusual because I've never seen him before. He was huge. So I'm a bit curious to know where he's arrived from. But yeah, there we go. And I nominate Louisa.
Thanks, Vera. Hi, everyone. My name is Louisa Borley. I'm Community Health Development Officer in the Public Health Team at Enfield Council. My role is largely focused around, at the moment, vaccinations and immunisations, but I support the team with all sorts of different community engagement pieces of work. In terms of nature, it wasn't this morning, but in my local park at the weekend, I actually heard a woodpecker.
Oh, wow.
Very, very happy and making a lot of noise, which was really good to hear. So, yeah.
Thank you, Louisa.
Thank you. I will nominate Jenny. Thank you.
Hi, did you say my name?
I did, yes.
Yeah, okay. Yeah, it's Yanni, Jani, or Jenny. Hi everyone. I'm currently the Community Development Support Officer for LB. I think I joined because I've also volunteered in my local community, but I'm here primarily to connect with groups, because our team works closely with all the VCS of Enfield, and although I've come across quite a few of you, and I would love to have you on my database so we can send you information or connect you with other teams within the council. But I'm going on a secondment role pretty soon, and I'm going to be joining the housing services, and then I'll be mainly working with our residents and tenants and leaseholders. So I'll be more down on the ground, working with our residents. So I think having those connection within networking within EVA and other groups will be very helpful in my new role within the council. And yeah, that's a bit about me. I would love to connect with everyone, especially Carmen. I do an admin role for the Older People Partnership Board, and digital inclusion or exclusion is a main theme at the moment within the VCSSG as well. Yeah, sorry, I'm a bit going on now. Nature-wise, I've got 6 rabbits, so I see them every morning, with the cats sitting on top of their cage, looking at them, down at them. God knows why. I don't have any cats, but I always see cats on the cage of the rabbits. And yeah, so I will now nominate. I think Corinne, maybe. I think Corinne hasn't spoken. Thank you.
Morning, everyone. Hi, my name is Corinne. I'm Deputy Operations Manager for Enfield Unity PCN. My role is basically just supporting GP practices. We currently work with 20 GP practices. We have one super practice called Medicus, and we have about 14 care coordinators that I manage to help support the practices with projects that they roll out. So it could be their diabetes, there's CKD. We also do extended hours. I think a lady mentioned about homeless service that we started to bring in also. We're currently running the COVID vaccination hub from Carlton House Surgery. And I also manage 5 social prescriber link workers. So yeah, it's a hectic task. And nature-wise, I would say I just saw some pigeons this morning. I don't really have any animals. I used to have a fish, but they kept dying, so I don't want to try and have any other animals. And has everyone spoken, I think?
I think we've got Jordell to speak.
Oh, I'll pass it on to Jordell.
Oh, thank you very much. Hello, good morning, everybody. My apologies for joining late. I was just coming out of another meeting. Yeah, to introduce myself, my name is Jordelle Akinola, and I'm the Community Engagement Lead covering Barnet, Enfield and Haringey. And we're now working in a partnership with Camden and Islington. So I've got a counterpart colleague covering the Camden and Islington boroughs. And yeah, apologies, I missed the animal bit. I was trying to work out what was the question with the animals. Or nature.
Just what bit of nature did you notice today?
Oh, well, I think yeah, similar to everybody else. I know the first thing I noticed this morning, opening my curtains, we have a squirrel that comes and just like hops across the fence every morning, and I think it's the same squirrel from last year as well. They tend to like bury, I think, acorns in our garden. It's very disruptive for my husband because it ruins the lawn, but I think it's very cute, and he reminds me of the squirrel from the films Ice Age. I don't know if anybody's seen those Disney films, but yeah, he's grown on me.
Thank you very much, Jordelle, and it's nice to have you here. I think actually, just because I was talking to Kilner to start off with, I've forgotten that Kilner hasn't spoken. So Kilner, you're our last person to speak, I think. My apologies.
Hi everyone, so I'm Kilna and I'm representing the Our Voice Parent Carer Forum in Enfield. So we're a parent forum which supports the parents of children and young people who got disabilities and special needs in Enfield up to the age of 25. And of course, is one of the groups of children and young people that are so often missed out and actually require quite a huge health sort of advocacy from parents as well as from professionals. So we're supporting the parents and children as well, and running various events in Enfield, which looks after the young people. And we've actually recently received funding to run a healthy parent carer course for parents, because so often the parent carers actually are so involved in looking after their young people and children with additional needs that actually aren't really looking after their own health. So this course that we're running is actually specifically for parents who have got children with additional needs, because you do get a lot of parenting courses, healthy parent courses, but it doesn't really cater for those with additional needs. And interestingly, Helen, when you've just asked us to say something about what we've noticed this morning, one of the things that is a part of this healthy parent care course is, we're looking at the 5 ways of well-being, and one of it is about noticing things out there rather than thinking about your children and young people that they're caring for. So we're running this parenting course for about 6 weeks, and we're going to run it every term. Parents of Enlist by emailing us about it. And bit of thing that I've noticed about nature, I suppose, I mean, like Vidya, I think, say, it is teachers' strikes, so I've got the girls at home, not been out anywhere. But however, sitting here and looking out in the garden, I've been noticing there's a cat that sort of usually comes by almost every day, and it hadn't been today, and I was sort of wondering what's going on. But anyway, it's appeared at the moment. It's really a well looked after cat, which I sort of seem to like when it just pops by. Thank you.
Thank you. Now, I think one of the most significant things about a network event is networking. So normally with a big list, big attendance, we can't do the round because it would take up the whole meeting. And that is the value of an in-person event, is that over the cups of tea at the breaks and what have you, you get to meet people. So and I haven't held one of these events in the last 2 years or so where people haven't made connections with other people to work together or to reach a target group of people. Today we've talked, there's quite a bit of training that's been spoken of today. People have talked about training that's available. So what we do is, as part of the papers that we share after this meeting, we share the recording, but we also share a list of who attended and your email addresses, the organisation you work for and your email addresses, so you can connect with each other. So what I need you to do, because some of you, because this time we didn't book everyone through Eventbrite, with EVA are changing its booking system where I then capture the email addresses. I need you to put in the chat just your name and your email address, please, and then I will make sure that it is shared amongst the group, and you can make your connections. I mean, obviously you can use the chat to make the connections, but I will make sure that that list is circulated, because I can see some connections already, and we know that health inequalities and long-term conditions like diabetes, for instance, and other issues aren't just because people are eating the wrong food. Biologically, that might be the reason, but I experienced a significant bereavement in January, and one of the things that I was unable to do after that bereavement was think about nourishing food. And I found myself at one point being hungry, obviously regularly, and reaching for a packet of crisps, just a packet of plain crisps, because it was neutral flavor, relatively neutral flavor. It just met my hunger need, and it required no thought whatsoever. Now, I wasn't eating crisps because I was into junk food. I was in a state of I was in a grieving state. But the point is sometimes if we take a linear view to addressing people's challenges, then we're missing the point, and we have to work with the bigger picture, and that's where working together really is of value. So please do share with me. I know some of your email addresses. I'll seek you and find you like a heat-seeking device. But those of you on the call who perhaps it's the first time you've joined this, or you're not familiar with me personally, then please share your email address. I've also put in the chat some links to some resources that I think might be of interest to you. There's to do with what they call community assets, but activities and things that are going on in the community that you may not be aware of that resource. I'm also planning on running a health champion training programme in the autumn. So if any of you are from organisations where you want to recommend someone to complete the Health Champions training, the Health Champions training is accredited. It's expensive and it's covered by the funding for this programme, but it will. We're always looking for the right people to go on that training and to become part of the network. Now, just before we move into our breakout rooms, who's just joined us? Who's just joined us? Sorry, I can't see who. Oh, Lutfa.
Hi. Sorry, Lutfa. I was in another meeting. Sorry.
No, that's okay. No. Lutfa, we've literally just finished around the room, so you've missed what everybody had to say, but that's fine. We're going to share the details, and this meeting has been recorded. But could you just explain who you are, Lutfa? And we asked people to just give us your name, the organisation you work for, and what your focus of activity is. Tell us and tell us a piece of nature that you noticed today.
My name is Lutfa Kudus. I'm the Community Hub team manager for Enfield and Edmonton Green Community Hubs. So I work for London Borough of Enfield. The Community Hubs are designed to support the community in holistic ways, looking at complex needs, building up their strength-based conversations. We also got pantries on board, supporting people in needs, which is via referral process, via welfare team. Sorry, Helen, what was the other?
What's your piece of nature that you maybe noticed today?
Today, piece of nature. I would say, can I say the weather was okay today? It was cold, but it was sunny. That's what I felt.
Yeah.
Positive note on that, on the positive note. Yes.
Good. Thank you. Yes, I mean, we do need the sun, don't we? We absolutely need that sunshine. Thank you, Lutfa. Now, I'm really glad Lutfa's here because somebody, was it yourself, Kilner, mentioned, or somebody, sorry, mentioned people not being able to afford good quality food. So look, within the programme that Lutfa supports in the community hubs, there is the Enfield Food Pantry. So we've asked everyone, Lutfa, to put their email addresses in the chat so that I know your email address, but after the meeting I will share a list of, and then people can connect with you. And normally as well, what I try to do when I share that list is put a web link to your organisation if I've got it to hand. So I will do that as well. Thank you very much. Right, what we're going to do now, I was just saying, look, for that, the really the most important part of these network meetings is to network, and so with this, it's been a valuable contribution that everyone's made because we can work together. But what we're going to do now is we're going to go into some breakout rooms, and we're going to discuss what is it that you want or need from a health champions and stakeholders network meeting. And if you remember that at the beginning of the meeting, we looked at what the Health Champion programme is meant to achieve, which is connecting with the individuals from voluntary sector organisations who are the specialists in their area of work, and it's about helping to address health inequalities and transform people's lives or support them to access or to have a life that's that features health and well-being. Now, I just want to remember that aim, so that because this network meeting is about facilitating, you know, how we support you to achieve that aim, and the network meetings need to be what you want. So I'm now going to just take a moment to allocate you to a breakout room, and then if we can have, I would say, let's have a look at the time, 10:51. I want to leave 5 or 10 minutes at the end, so that's half an hour. So if we said if I said 15 minutes, or does people think that's too long? I mean, there'll be about 3 or 4 of you in the meeting. What I'd like you to discuss in the meeting is it's on the agenda, is format, content, length of time, themes, anything else you want to discuss that you think is relevant. And then what we're going to do is, so the first breakout room will be about the network meetings generally, which it seems to suit people that they're online because you haven't got the time traveling to them and it doesn't take up so much time. But we are going to have an in-person event in July, and so when we do the second breakout room, we're going to discuss specifically the in-person event and how we want that to look. So the first one is just about networking and the network events generally, and then the second breakout room will be specifics about the in-person event. And what I'll need is for one person in each group to just take some notes, please, and then you can share them with me. You can photograph them and share them with me afterwards, because I won't be able to be in all the breakout rooms, so I can't capture all the information. Right, bear with me while I just put you into your rooms. Right, and I've opened the rooms. Oh, Tony, have I not assigned you? Oh, sorry, Tony.
No, you've not assigned me yet.
There you go, I've assigned you now.
Oops. Kicked out.
Sorry, did that bump you out
Yes,
mid-sentence?
we got bumped out.
Yeah.
Sorry.
I got bumped out in mid-session.
Sorry.
We are back. Hello.
It's a bit rude, isn't it? Thank you, everyone. How useful was that discussion? Some nods there. Brilliant. Okay. So what I'd like to do is because I think discussion is kind of really important, and then I can gather your feedback and go through it and then like just summarize it and share it with the papers. So whoever was taking notes, or maybe you all were, if you could, I'd really appreciate it if you could photograph or scan or whatever. It doesn't matter if it's just scribbled notes. I'll make sense of it, and if I've got any questions, I'll ask you. And if you could email that to me, I'd really appreciate it. So what I was picking up as I popped in and out of your rooms, I was only popping in and out of your rooms to sort of make sure that there was a discussion going on, and there was a rich discussion. What I do pick up, of course, is that the real value is in being able to talk to each other. So maybe what we need at these events is more breakout rooms so that people can have a discussion, but maybe in order for it to be managed and so that it's not all over the place, is that we have themed network meetings. So the theme will be about, smoking cessation or reasons why people have got diabetes, not the medical reasons, but the socioeconomic reasons, blah blah blah. But anyway, we can explore that. So if that's giving you any more ideas, then jot them down, and because I want these sessions to be of value to the participants, not just me ticking boxes for my funding. And this programme is funded to be exploratory. We can change things and make it up as we go along if we want to. So what I'd like to do now is take 14 minutes, 15 minutes to have a discussion about an in-person event in July, specifically in July. So the sort of questions that I want you to consider, I'm going to put you back in your same groups. So please don't revert back to your previous conversation. Please give me some, have a discussion about this. Is what would you like to see? So where should the venue be? I'm thinking of Lutfer. I'm thinking of Edmonton Green Library or Community Hub there. But what do people want? Where's easy to get to? Be aspirational. Do you want refreshments? Is it nice to have a bowl of fruit and some pastries? But
Yes.
Whatever makes it conducive for an event where we're getting to know each other. How long should it be? I would say an in-person event does need to be 2.5 hours, what we class as half a day, but say what you want. Should it be a whole day? I mean, that's a big chunk of time, but if we're going to the trouble of an in-person event, should we have some guest speakers and some workshops? And that's all creating more work for me, but what is it you want? The content, should there be workshops, breakout rooms? Should it be conference style, a hybrid? But maybe subjects and themes. What is it that's really burning issue for your community right now? Yeah, so if you can just, sky's the limit, say what you want, and if someone or all of you could take notes and then let me have them, but we won't discuss them. What I will do is, if there's an appetite, is I will be in touch with you to see if we needed like another little subgroup meeting about, okay, Carmen, cheers, thanks. If we need to have a subgroup about putting on an event, or I can just work from your notes. Right, without further ado, so it's 11:13. So if we give this till 11:25, which is 12 minutes, so you can put something down. Okay, thank you.
It kicked me out.
Sorry
again,
if you were
and I went,
mid-sentence
Just as I
again.
was just promoting Enfield over Waltham Forest, and you just spot it there, Helen.
Sorry about
Oh,
that.
oh gosh.
Right, thanks ever so much for working with the rooms. I really appreciate that. Are we all back? I think Corinne had to leave, I think.
No, I'm here. I'm here.
Oh, you're here. Yeah, okay.
Yeah.
Was it Carmen who had to leave? Sorry, Carmen who had to leave. Yeah. So we've just 12 of us. Right. Okay, so we're all back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Thank you very much for doing that. So have you come up with some good ideas? I did notice that you're going for an all-day event. That seemed to be a bit of a, I say all day, 10 till 4 or something like that. Is that a bit of a theme that was working? Is that what people were
Yes.
thinking?
I think
Yeah.
we were thinking like it would be more productive to spend
Yeah.
the whole day rather than rushing back to work half a day. You've got that, thing in your head that you have to rush back. Plus, it would be more productive if you have small workshops or breakout rooms or have a themed activity for the day so everybody's prepped to share what they have. It's a good network platform, isn't it? Where you can actually build on things from there or start things from there.
Can I have a show? Thank you, Jenny. Can I? Lutfer, sorry, that was Lutfer, wasn't it?
Yes.
Yes, sorry. I was looking at Janie's name as I was speaking. Can I have a show of hands? How useful has today been for you? I mean, it's okay to say no. I'm not going to get upset.
No, in this short time,
It's been
great for me.
fantastic. Sorry,
Yeah.
I'm going to show my hand, but it's been fantastic.
Fantastic.
Yeah, great. Okay, so I'm getting a general consensus. Thank you. If anybody, of course, thinks that it's been a waste of time, then please tell me, because this is what we need to know. But I'm going with the majority there. So, have you all put in the chat your email addresses? And if you have, thank you, because I can then get the information from you. Those of you that were taking some notes and have got some thoughts, can you just take a photograph of them and email them to me, if that's possible? That's, I think, the easiest way of doing it. Or if you'd rather we had a short chat, I'm more than happy to just have a phone conversation. But I was just trying to make it easy, and then I'll do the work. Now, I like the idea that I was picking up as I was in and out of the rooms of workshops, opportunities for people to talk. Andrea, I noticed your comment about vegan. Yeah, absolutely. Yeah, so and also I was wondering, it occurred to me that it'd be really nice. We've got 1 or 2 food organizations like Bread and Butter who have hosted a health champion and have had funding from this program. It'd be really nice if we could perhaps do something with them where they might get involved. I mean, Vicky will be involved anyway. I know that she supports everything if she can. But yeah, and did I hear some of you talking about getting service users to also attend and be able to speak about how the service, what the health champion or the organisation has done, because service users wouldn't necessarily realise that people are health champions or volunteers or paid staff. I mean, service users are just using a service. But yeah, so we need to perhaps look at that, and that's something I can talk to the health champions about. Okay, now somebody's got their hand up. Corinne.
Yeah. Yeah. So I think the main object in my group was that, having an all day could be like 10 to 4 different varieties of food, and having like a hybrid conference. So, we have speakers, we do little group activities on our tables, and just being able to network face to face, and obviously just having more information. So like what the health champions do, how do you get on the program, what is the funding, how much if we would have to contribute, or is it funded altogether, what is the criteria, so who can actually go on this course. And just general information like that, and then having other speakers, talking about mental health. We've talked about mental health so much, so having mental health speakers come and say how they can help our organization. You may not think, it may not be directly to you, but they may say something, they say, oh, we need that. So just having that personalized touch. I know COVID has made everything digital, and we're all in the screen, but just getting together and just being able to touch your neighbor
Yeah,
So yeah.
yeah. No, absolutely. I mean, digital it works on one level, but it actually many things that isolate us. I've experienced it recently with bereavement. It's amazing how quickly science actually there's evidence of this. Okay, Jordell, no problem. So there's evidence of this that once we deteriorate very quickly when we're isolated, and I noticed that this year with my own experience, and that's I'm quite well connected, right? And I noticed that Carmen, who has had to leave, she was actually working with digital exclusion, so that would be a theme. Yeah, okay, lovely. Look, I realise that, oh look, Thurs team runs a regular shindig where people can network. Oh, okay, well we don't need to reinvent the wheel if it's already going on. So where's that? Just in the chat, and then I'll, oh okay, 27th. Okay, a shindig, great, I love a shindig. Okay, okay then. So what we just need to remember is the Health Champions Network is about the system. It's about system operatives, you know, whatever our role is, volunteer in a voluntary organisation, a paid member of staff in a voluntary organisation, a person running a project within a statutory service, and so on. So is your shindig, Lutfer, is that for members of residents?
Yeah, residents comes, all partners are invited. We do like small activity groups where we involve partners to lead a group and talk about certain topics to see what the residents are saying. Like last time we had what makes you feel happy, and what are the signs that makes you feel sad, and what would you see be improved in the community. So we can talk about, like, if it's around mental well-being, we have a group that will discussion mental well-being. Somebody can have a group about environment. So it's the teams can lead, lead a group and just have a discussion. So it's pop-up discussions on the day. And it was well attended. We had about 44 residents turning up that
Oh,
day,
that's brilliant.
from 3 months to all the way elderly people. And refreshments is a big,
yeah,
I would say, yeah, a big thing there. It really opens up and it really gets you to engage with them well. So yeah, we had from public health, from other departments as well. Jani was there as well. So yeah, I think it's a good way, but it would be nice to have more partners coming in. And if you guys do have time, it would be good to tap in and just to introduce yourselves. And yeah, maybe we can, after the shindig, have a discussion to see how you guys felt or what you can offer to the residents that we can promote.
Okay, so the shindig is very much an opportunity for health champions and their organisations to engage with the public, promote their service, blah, blah, blah. Lovely. And it might be nice at our event on the 20th of July to just get some kind of summary from you, without creating a lot of work, but maybe a few photos or something, so that you can tell the audience that we're going to be working with about the shindigs, because we in this space, the health champions and the stakeholders, are organisational people, and what we want to do is make sure that we are linking the voice of the community with policy, strategy and service provision, and that's the objective of our network, is that we keep that in focus. But of course your shindig, I love that, so we can perhaps, you know, work so that we complement each other. Oh, lovely. Kim wants to collaborate and attend. Lutfer, there you go. I'm going to, I'll work on the papers and try and get them circulated tomorrow, if not tomorrow, by Monday. So you should be able to all connect and take things forward from here. So I just want to thank you. We've gone 4 minutes over. I do apologise. I hope it's been of value to you today. If anybody, I've put some links in the chat regarding EVA's newsletter, and EVA runs a few networks as well as this one. And on the newsletter page link that I've sent, you can tick which networks you are interested in, and two of the important ones that I think are relevant are the cost of living network and the mental health network, and they are networks designed to represent or to get the voluntary sector involved in those conversations. They aren't networks, they're not statutory led, system led networks, so they are about the voluntary sector and those themes. So no biggie for me then for organising July the 20th, but I'll look forward to that. I do like to organise an event, and if anybody's got anything they want to just share or say, then shout it out. Otherwise, when you've all left the room, I will close the meeting. Thank you.
Bye.
Thanks, Helen. I just wanted to
Thank
say
you.
it's
Thank
good to
you
see
very
you.
much,
Talk to you
Helen.
soon.
And again, if
Take
anyone
care,
would like to
everybody.
collaborate with me, you've got my email address, unitedwerisuk@gmail.com. We'd be happy to have you on board.
Thank you. And
Helen,
same here as well.
thank you
Helen.
again. Thank you again, Helen.
You're welcome.
Thank you. Bye.
Bye, everyone. Bye-bye.
Bye. Have a good day and a good weekend. Oh, good bank holiday weekend.
Yes.
Yes.
Oh,
bye-bye.
Janie,
Jenny.
before
Okay,
you
yes.
leave,
Yeah.
you mentioned in the chat about the OPBB and the SSG. What was it that you were thinking about with respect to that?
It was the digital inclusion, because both networks mentioned the same issue, especially for older people. How can they access digital, getting data, getting a decent device? The reason I raised my hand was about the venue.
Oh, I'm sorry. Did I ignore your
No,
hand?
no,
I
no,
am
that's
so
fine.
sorry.
That's absolutely fine. It's about the venue. Tony, I don't know if he's still here. He said, Edmonton Green, although it's very good and easy to access, he would like to see somewhere where people have not been to, a bit different. So what I was saying, I've worked on a list of venues, especially when you mentioned the breakout rooms, where if you have a venue but different little rooms where people can go into. So I've got a list of venue, and if you'd be happy, I'll share this with you.
Yes, please.
That'd be
Yeah,
lovely.
so you can have a look at. And well, I've been working on it. I think I sent a copy to Chris because he was asking, but I haven't shared it widely. But I'm very happy to share that with
Please
you
do.
and have a look at. Yeah. Okay. Yeah, that's
Thank
why
you.
I raised
Thank
my
you
hand.
very
But
much.
thank you. That's
Sorry,
okay.
I missed your hand. My
No,
apologies.
that's absolutely fine. And thank you for inviting me today.
No. Thank you for coming.
You.
Thank you for
Thank
everyone
you.
for
Take
coming.
care, everyone.
Bye-bye.
Bye. Bye.
Thanks.
Bye.
Thank you. Bye.
Bye, everyone. Bye-bye.
Bye. Is Andrea still pumping iron? And Kim, are you still
lately? But no, thank you very much. Have a fantastic weekend.
Thank you. You too. And look after yourself, Kim.
And you. Thank you. Bye-bye.
Take care. Bye-bye then. Bye, Andrea.